Good morning, everyone. I, Dr. Kirti Mathur, Assistant Professor, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences, would like to extend my warm welcome to our guest and speaker of today's webinar, Dr. Arzu Bala ma'am. Welcome, ma'am. I welcome my colleagues and all the dear students who are attending this webinar. Dr. Bala has more than 13 years of experience in the area of child development. She is certified in oral placement therapy and sensory integration from the University of Southern California. We are honored with your presence, ma'am, and I'm sure our students are going to get a lot of information from today's webinar. Now, I would like to hand over mic to Dr. Bala. Ma'am, you can continue.
Thank you so much, Dr. Kirti. It's a pleasure to be here, and a very good morning to all of you. And I'm really looking forward for this session for all of our physiotherapy students and for the staff. So today we are going to talk about autism. Many of you must have heard about it. Many of you have been with children with autism in some way. So today we are going to talk what are the early signs of autism and what is this exactly. And along with that, I would be talking about how can we understand about sensory processing issues which children with autism face, and so that we can help them further. So this is just about me. By profession, I'm a physio, and I did my master's from KMC Mangalore. And it was my passion to work with children. And when I started working with children, and we were seeing that many times they were struggling with those sensory issues, and their sensory processing and development was not happening. So that was the time when I did my additional training in sensory integration therapy from University of Southern California. And in the picture you can see Arna. I learned a lot from her. And how can we help our children to develop their functional skills? I run a clinic in Noida with the name of Tickles Child Therapy Center, where me and my team help the children to reach their full potential. So, what is autism? So, autism is a spectrum disorder. So, when I say spectrum, that means like it has a different range of difficulties or challenges which a person can have. It is a neurodevelopment disorder which is characterized by the very specific thing which they have. One is deficit in social communication, and they may have presence of restricted repetitive behaviors. We are going to go in detail to discuss about what do we mean by social communication issues, what do we mean by those repetitive behaviors. So, as I already mentioned, it has a broad range of conditions where you will see children having issues with their social skills. They may have some repetitiveness in their daily routines and in their play, and they may have challenges in their speech and non-verbal communication. So, as I mentioned, it is a spectrum disorder. Every person with autism, they may have different set of strengths and challenges. So, we say it, if you have met one child or one person with autism, you have met only one person with autism. That means every child or every individual is too different. So the ways in which people with autism learn, think, or they do problem solving, it can range from highly skilled to severely challenged. Some people with ASD, they may require significant support in their daily lives, while others may need less support. And many of our children or people, they live entirely independent. They can be very brave. They can perform very well in their all the ADLs or activities of daily living. It's a neurobiological disorder. So there was many research like what is the cause of autism? Is it genetic or is it environmental? There have been many theories about it. There have been theories about is it when mother is not much paying attention to the child, if that used to call refrigerator mother. That was a long back in 50s, 1950s. But the reason now the whole research says that it is influenced by both genetic as well as environmental factors, which is affecting the developing brain. So symptoms must be present in early developmental period of the child. Okay, and it can again, as I already mentioned, you will see the issues in their social life, in their communication, in their occupational skills. So overall, the functioning can be affected. Uh, the data is really alarming how the prevalence of autism have been increasing in last few years. So in 2021, the CDC have reported approximately 1 in 44 children in the US are diagnosed with ASD, and in 1 in 27 boys are identified, and 1 in 116 girls are identified. So boys are 4 times more likely to be diagnosed with autism than girls. Early intervention afford the very best opportunity to support the healthy development, and you can see a lot of benefits across the lifespan if you start the early intervention. So that's why I think it's very important that we are able to identify if a child is having red flags or early signs of autism. So many times what happens, the diagnosis happens very later in age. So when there is diagnosis is late, intervention is missed, right? And those early years are so important for us. We say like billions of neurons are waiting to get stimulated. So that's the thing we are going to talk today with all the professionals. How can we identify these signs at very early age? Because sometimes parents may not be aware about it, and there is no medical test for autism. Okay, there is no blood test or no test which can define if child or a person have autism. So we will go little in detail now, as I defined you that yes, what are the core symptoms of autism, social communication challenges, and what do we mean by that? Because social communication changes in lifespan, right? What do you expect a child to do at 6 months? It may be different what you expect them to do at 2 years, what you expect them to at 3 years, or what do you expect them to have at 10 years of their age or 20 years of age. So there is a whole lifespan of social communication. And at young age, if I'm seeing a child who may have autism, what could be those signs which I could identify? And when we talk about restricted and repetitive behaviors, it can again have a different range depending on their sensory profile, what sensory sensitivities or under responsiveness they have. So we will be talking about that as well. So when it comes to social and communication, so why do we communicate and how do we communicate? First, we, as a professionals, we need to understand what are the stages, right? So communication is not just speech. We use a lot of gestures. We use eye contact. We understand facial expressions. Yeah, what is the tone of your voice? If I'm very excited, my tone may change. If I am upset, I may be very slow. If I'm very shy, I may be very hesitant to speak. So these are a lot of gestures, non-verbal, which we help us to understand the context with the other person. If somebody is sad with the expression, you know that he has a bad day. How you gonna deal with him? How can you use those gestures? So what happens, children and adults with autism, they have difficulty with verbal and non-verbal communications. So when I say verbal, that means it's a spoken language. I see you all and I say hi, how are you? Okay, I'm using the verbal communication. But along with that, you came to my room and to my place. I did not even look at you. I'm too much lost in my world. I'm just playing with my gadget or with my car, and I am not even aware about a person who is sitting in the room or who is entering into my room. Yeah, so those are the challenges we may see, and we will go in detail how the children with autism or people with autism face that. And when we talk about restricted and repetitive, repetitiveness, that for the lot of time you're repeating the things, same movements. So if a person is too much involved, maybe in spinning the wheels, child is just spending hours playing with wheels of the car, or he's running back and forth, he's spinning himself, he's just flipping the pages of the book. staring at the light. So there can be many variety. As I told, I was just going to the few things which are very very common. You may see flapping of hands. Okay, you may see rocking. See, right now I'm rocking if you all can see me. Yeah. So these are the things are into the repetitive behavior. Why that happens? We are going to talk about it even in the sensory perspective. Along with that, they may have very much ritualistic behavior, lining up of on objects, playing into own way. I am just lost in my own way. If you see a child who is at early signs of autism, they may be too much in their world. They may have a very narrow interest in specific topics. I'm not looking at mama, I'm not looking at somebody, I'm not following commands. They may show resistance to change, very fixed with daily routines. So there are many movies and series about autism. If few of you have got the chance to watch it, those are lovely. Like if you have watched on Netflix, there is Good Doctor. So that's recently I'm watching, and it's amazing series to understand, because many times when we feel, oh, it's a disability, no, every child with autism is very different, provided they need a good support and therapies and inclusive education, because their brain wiring is different. They're learning in a different way. Yeah, they may be very good visual learners, they may be very good with numbers, as we all are different in our learning skills. But along with that, they have some restrictiveness, they have some repetitiveness due to their some sensory issues, which affects their functioning a lot, so we need to help them. So I'm talking about sensory processing issues, just putting it here itself. So when we talk about DSM-5 criteria to diagnose autism, which is done by development pediatricians or psychiatrists, so there, when we talk about restricted and repetitive behaviors, what could be the cause of that? Many times, children with autism, they may have sensory processing issues. They may be hyper or hyporeactive to sensory inputs. So, as we all know, there are eight sensory systems. Yeah, you know about touch, you know about auditory input, visual input, gustatory. Yeah, along with that, very important internal two systems, vestibular and proprioceptive. So, sometimes, if a person is having sensory modulation issues, where his responses are either hyper reactive to that or hyporeactive to that, you may see these indifferences. They may have adverse response to specific sounds. As children clap in the class and I just cover my ear. They may be excessive smelling or touching onto things. They may have visual fascinations with lights or movements. So these challenges can happen. So in very young age, when we see, so I will just move my slides little back first to tell what do we see. So as we all know, by 3 months, even before that, children starts giving eye contact, right? They have social smile. They really get into engaged into joyful expressions with their parents or caregivers. But if you see a child who is having very few or no warm expressions, limited or no eye contact, that's alarming for you. Why I bring it here? Because I thought, okay, let's go to those slides later. By 12 months, child starts babbling from the 8 months itself, right? From the 6 months, I would say. So if a child is not babbling at all, there are no back and forth gestures. You say, ha, ha. So child can't speak, but they would revert back. At 3 months, you can see cooing. So that's why I say, as a professional, we have to know the normal development. And what is this? This is a normal. So maybe we are aware about the gross motor development. Okay, by 6 months, child should be able to sit. By 8 to 9 months, child should be able to crawl. So those are the milestones. If they are delayed, it's alarming for us as a professional, right? Does child has some delay or any underlying reason? Same happens with the social and communication milestones. Same happens with the emotional development. So if you see these signs, you are going to have those alarms up. Okay, his child is having some red flags. So by 8 to 12 months, children start developing pointing. So we being physio, you know that pointing starts at 10 months. They have that much of control that they can use their index finger to point if they want something. So as a motor development, it happens. But the intention to show something has a lot into communication milestone. So maybe when I'm using a phone, I'm using my index finger to scroll. So as a PT, you know, it's fine. He has the pointing, right? But he's not using that to point to something. That's alarming for me as a social and communication milestone. So are you getting how I'm relating that one is the physical development? Now a child with cerebral palsy who can't point because he doesn't have hand function, that doesn't mean that child have autism. Does he have intention that I can point and ask for something? Can I show? So many times you will see children with the cerebral palsy or dystonics, they will use their eye gaze, right? They will show you, they would smile at you. So what they're doing, they are still communicating with them. Yeah. Reaching for somebody, okay, take me in lap. I am reaching for the toys. And I tell, okay, bye bye. Clap your hands. So one is a motor action of that, which we are concerned when you're working with children with motor delays, but the other is the social communication part. At the same time, if child is having no response to name, so by 12 months we expect child should be able to respond to his name. If he's playing with something and mama says Saisha, Saisha should really look back, okay, or response in some way, so that may be affected. Okay, so as we know from the development itself, from 12 months, children start using single words papa, mama, dedo, bye, chacha. These are the single words you expect from 12 months to start with. Every child is different, so development always have a range. Na? 12 to 16 months, you're expecting to have some single words. At 8 to 10 months, I was expecting to have some babbling. So don't get confused babbling with the words, okay? Babbling is your babbling, words are the clear single words. So if a child does not have those single words, first birthday is passed over, and child still doesn't have words, child is not responding to name, child is not giving eye contact, so it's alarming for me. Yeah. By 24 months, if you by 2 years of age, by second birthday, child can combine actually two words together. Okay, so we are talking about all the language and communication development now. Those are the milestones you're expecting. They are able to imitate. When I say imitate, what does that mean? Copying. So whatever we speak or whatever we do the action, children are able to copy that. If you're so this example I give to many parents. If you are speaking in English country, you are English and your child is speaking English. If you're talking in Malayalam, your child is talking in Malayalam. They are imitating those actions with understanding. That may be limited. Many times they may not be able to copy those actions. And at any age, okay, now we go back. What are the early signs? So, early signs at every age is different. Now, a 6 months old child is not speaking, we know that's not his age milestone. Okay, so if a person or a child doesn't give you eye contact or makes a very little eye contact, poor response to name, no response to parent's smile, may not look at objects or events a parent is looking or pointing at, look there, oh, there is an aeroplane. Yeah, but child doesn't put that attention what you are showing them. Yeah, they may not point, child may not point you, they may not have finger pointing to show. You know, children like even when they don't have a speech, they use so many gestures. So I did one training of Spark program, which is again for children with language and development delay, that talks a beauty about the development. So as PT, we have learned a lot about motor milestone, and it was about the social and communication milestones. Children are so intuitive. If they love something, they will look back at their parent and they will say, see, I'm playing with it, I got this, I looked at the aeroplane. And they will look back at you, they will look at the object, they are joining your attention, look what I have got. I have got a car or I have got a ball. They're still not using words, but they are using communication. That's why we say, why we are not saying autism is a speech delay. No, it is social and communication delay. And yes, their speech is also affected because that's also the part of communication. So, as I already mentioned, you may have no finger pointing, says no single words by 15 months. That's alarming for me. They are not joining two words together. Mama come, Papa bye bye, Bahar chalo, let's go. So, two words they're not joining by 24 months. They repeat exactly what others say. Sometimes they have echolalia. Echolalia is just say we say, I said something and they repeated, what is your name? And child says, what is your name? Come here. Aisha, come here. He says, Aisha, come here. So they are not understanding, they are just echoing. That also happens many times with children. As I already mentioned, they will not respond to sounds. So many times parents feel, oh, my child is not able to hear it. And they go for some testing. So yes, we send many parents for the Bera testing and all to understand is the structure, so child is able to hear it or not. Children with the ASD, they are able to hear it, yeah, but to the specific sounds they may not respond. That is auditory processing. And there are few children who may lose language and speech as a milestone, which is called regression. Between the age of 15 to 24 months, a parent says, oh, he used to clap, he used to say bye, he used to look at me, but suddenly he stopped doing that. So the regression is also one in five cases, you can say. Behavior differences. So earlier it used to call behavior, but now from the whole science, we know when child is spinning himself or walking on toes or flapping hands, this has to do in there with their sensory processing. So that's the role of a sensory integration therapy. So we practice a lot of sensory integration with our children with autism to help them. So when you say, oh, they have these behaviors which are not helping them to achieve their other skills, you are actually going down to figure out why a child is rocking himself, why a child is spinning, why a child is walking on toes, why they are so distressed, so rigid. They may sometimes they may not cry when they are hurt. They may not understand fear. They may be too sensitive to smells or not aware at all. So there can be both ranges, which we will talk about, hyporesponsive and hyperresponsiveness. They may look from corners of eyes. Yeah? So lining up of toys. So those are the very, very common findings you will see. And this happens many times due to sensory processing issues. So we know there are several factors which can influence the development of autism. One, definitely, I said sensory sensitivity and sensory under responsiveness, which we are going to talk because as a therapist, that's important for us. They may have GI issues, seizures, or sleep disorder. For that, you need mental health professionals like a psychiatrist or the neurologist who are going to help them when they have anxiety, depression, or attention issues as well. Okay, so diagnosis, age, and intensity may vary again. Okay, but you can see those early signs. So, when I started my career and started working with children with autism, we used to see them, at 5 years of age, at 4 years of age, because the diagnosis was not happening. But now, as we know, there are early red flag signs and which a doctor is able to identify. A parent is thinking, oh, something is wrong with my child. We are able to see children at very young age. Like in clinics, I'm able to see children at maybe 14 or 16 months of age as well. Yeah. And this is very specific that not all the children with autism have all the signs. So that's why professional evaluation is very crucial. So our goal is not that today you go and you see some child who did not point, didn't look at you, and you say, oh, he has autism. No. Autism has many layers to check with that. There is a whole DSM 5 criteria. How you are going to diagnose is there are different screening tools. So it's very with this information, maybe something is wrong with the child. You send them to the right professional, but at the same time, it is very important that you themselves, by seeing one sign or something, do not diagnose the child. Yeah, this I already mentioned. So, very peculiar signs which you will see. Yes, along with that, they may have motor development delay as well. Sometimes child is not jumping by 2.5 years of age. Child is too scared to sit on the swings. So those happens many times due to sensory processing issues. So I am going to talk about now sensory processing, which is very, very important for us as a therapist. So, as we talk a lot about motor development, I know that's our favorite thing to do, and we have been doing since so many years with the child development in teaching. Very important part along with motor development is sensory processing. Okay, so this is a process in which the central nervous system and peripheral nervous system will manage for the incoming sensory information which is coming from all sensory system. Touch, all our receptors are reaching the brain. Smell, it's going from olfactory receptors. Movement from my labyrinth. Yeah, so this all sensation goes to the CNS, and CNS will receive, modulate, integrate, and organize this. This all are the components of sensory processing. How do you relate, how do you modulate, how the integration happen. So this happens into the central nervous system. So if a brain has trouble in receiving and responding the information appropriately, that becomes a sensory processing disorder. And everyone has sensory preferences, but it becomes a sensory processing disorder when a person or child is on extreme end of continuum. Yeah, and it is affecting their development skills, their everyday functioning. Why I'm saying this? Because many times, whenever I took the workshop or webinar on SPD, many people came to us, oh, I have this issue. Yeah, I also have sensory processing difficulties. Yes, true. None of us may be 100% integrated, but how much is it affecting your development scale or everyday function? That something is going to be disorder to identify. So again, this I already said. Sensory integration was developed by Jean Iris, and I feel blessed to do the training in SI from Arna, who has been the student of Iris. And yeah, so she has mentioned it's a neurological process which is going to organize the sensation from one's body and from the environment, and making it possible for our body to use it effectively in the environment. So what that mean? Or that's the definition. Don't go in so tough part of it. Whatever is sensations happening with your body or with the environment, light is in the environment, sound is in the environment. Okay, body पे क्या हो रहा है? Touch, touch, proprioceptive or vestibular. So your body is making use of it to react to the environment. Yeah, I know this is I am on the swing which is on very high, so I have to be feel, oh, that's risky situation, I should be safe. This is a very crude touch or pain. When I'm using a knife, I may cut my hand, I am just being protective to that. That is the sensory processing helping us to use our body effectively in the environment. Yeah. So there are many terminologies of sensory processing issues. Sometimes we say it's a sensory integration dysfunction or sensory processing disorder. So don't get confused with all those terminologies. And very important thing which I want to point here itself, having a sensory processing issues doesn't mean you have autism. So sometimes sensory processing issues may be without autism as well. A child or a person with ADHD or learning difficulties may have sensory integration issues or sensory processing issues, and children with autism also have sensory processing issues. So children with autism, they are not diagnosed only with autism when they have sensory issues. Along with that, they have to have social communication issues. They have to have those repetitiveness. But a person or a child who has only sensory processing issues, they are SPD, or they may have some underlying, some other diagnosis as well. Yeah. So this is all the sensations which we're going to go very briefly. So you can see how the sensory integration is happening. In the brain level, all sensations get integrated. These are all our sensory modalities. So sensory processing disorders can be two ways. We're going to talk about sensory modulation, which can be sensory under responsiveness, sensory over responsiveness, or sensory seekers. So in a very, very simple way, if I say under responsive, that means my response is low. Sensory input doesn't have much impact as it has on other people. I may have poor registration. Yeah, I may not respond to stimuli because my brain does not register that. That is sensory under responsiveness. I'm defining it here because with all the system, we are going to see, okay, if a child is under responsive, what behavior will you see? When over responsive, what will you see? And sensory seekers, what would happen when they are under responsive and they are seeking for their sensation, they will crave for excessive stimulation. They are never satisfied with the amount of stimulation. They are on the go. They are too hyperactive. You cannot make them sit in place. They go on the swings into head down position. They bump into places. They touch everything. So those are seekers. Which sensation seeker? Whichever sensation you see. If a child on the vestibular is like that, is a vestibular seeker. Or child is bumping himself, proprioceptive seekers. I'm not going in very detail. I'm just giving a very brief to you guys to understand, because sensory is a very big word and this duration is very less to explain sensory. But I want you all to know, okay, something like this exists, which we need to help our children. Tactile seekers, tactile means touch, seekers means they are seeking, they love messy play, they put things in mouth. So a 6-year-old child putting everything in mouth, we know as a toddler it's normal because they explore through mouth. But these children will be too touchy. They want to lick onto things. They are seeking a lot of oral inputs as well. Proprioceptive seekers, these children, they may flap their hands. So I can't see you all, but if you flap your hands, you feel some pressure. They may have head banging. They may chewing on non-edible things, chewing on their clothes. They will walk on toes. So when you're walking on toes as a PT, we know, okay, one thing it can be TA tightness. What other sensory perspective it would be? So every child who is a toe walker doesn't have TA tightness. Children with sensory processing issues may also have toe walking. With prolonged use of toe walking, you can develop TA tightness. Yeah. You're getting my point? How you're going to define how sensory and motor is related? Very much related. They like to jump, they like to bump, they like to crash. They're seeking so much stimulation, pressure. Proprioception is joint awareness. They're seeking pressure. Yeah, as I already mentioned. Again, W sitting again can be part of sensory seeking. It gives a lot of joint pressure. They may have toe walking, teeth grinding, jaw stiffening. So, whenever you have think on the motor perspective, now the autism or sensory processing issues will help you to understand the sensory perspective of that. Child doesn't have cerebral palsy or child doesn't have some other neuromotor issues. So, what could be the reason child is doing this? So you're going to relate, is he hyperactive? Is he touching lot of things? So it's a whole domain you're going to check. They may be climbers. They want to rock themselves. When you're rocking again, you're getting a lot of stimulation. Vestibular seeker, we know our sensation, which is in our ear canal. And whenever there is a movement, you're going to feel it. So they like to spin themselves. They want to swing a lot. And they can take really high risk. They are very clumsy and uncoordinated. They crave for that movement. So now, when child has so much energy, they can't sit in one place. Forget about communication. They don't sit. So that's the role of sensory integration therapy in the clinics when I am working with child with autism. I am working to help them to regulate their sensations so that they are not much fidgety, they are able to sit still, and then I can work on some other skills where my language therapist or speech therapist is going to work. So that's why when you're dealing with children with autism or SPD, you need a whole team. So in our team, we have PTs, we are, because children with these issues can have low tone. So their low tone is not like a low tone what a child with Down syndrome will have. It's not hypotonia, but their muscle tone, their joints are loose. Okay. So many times, a lot of the motor skills are also affected. By 5 years, they are not able to do one leg hopping. Their posture is not so good. So that becomes the role of PT as well, working on their muscle strength. And sensory integration therapy you're doing, then the speech person is working with them. So what, as we said, that's a spectrum. It has a many domains. So you need a professional to work on all the factors to help the child as a whole. Yeah, so these children, as I already mentioned, they will spin, 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 and they don't feel dizzy. They like to go in head down position. I was working with one family, and Mama said, "Oh, he's so acrobat. On the sofa, he will go into head down position, legs are up, he's looking in the TV." So these are the signs for me because child is seeking and many times it can be dangerous. As very clearly initially we mentioned that they may be very excited to look at the moving objects. Those are the visual seeking behaviors or which are self-stimulatory. They get very calm, they feel good, they can look for spinning objects or lining up toys for hours. Finger flicking, you can see they are playing with their fingers and looking at that from the corners. So those are the things which you can again see with children. Okay, so this was all under responsiveness and seekers who are seeking. I'm seeking a movement, I'm seeking touch, I'm seeking smell. So seekers are, you are going to see them, they are seeking, they are craving for those sensations. Now, on contrary to that, the other problem is sensory over responsiveness. Now, my brain reacts more to that. When I react more to touch, I don't like to be touched. I don't like to be fed. I don't like many things because I feel it too much. So I was working with one child who was vestibular hypersensitive, and this child cannot even step up to the mat, which is of 2 inches. He was too anxious, could not manage to be on the swing. Extreme separation anxiety because many touch I may not like. They may be very aversive to hair cutting, nail cutting, brushing. Why? Now think about that over responsive. All eight sensations, seven sensations we know. Think about I am over responsive to that. Any one of that. It can be mixed of that. They may have frequent cry and meltdowns. So that's why our children are called many times moody. You know, many times we say, oh, autism, child is having so much behaviors, he's hitting everyone, he's crying. And that's the reason many people say, oh, their cognition is affected, mental retardation, intelligence issues. It doesn't go that way because they may have sensory over responsiveness. If you help them in this way, they can do and manage very well. So they have a negative emotional response. So what would happen whenever there is a negative emotional response? If you're too sensitive, our sympathetic nervous system comes in the picture, and there is a fight or flight phenomena, and then maybe child is very anxious or runs away or shut down. So that happens with our children when you see meltdowns and cries. So now if we talk about different systems, so this is in weight, like what all issues they have and what it can be. They doesn't like to be touched by others. Their self-care may be affected. I don't want to brush. Combing is something major issue because I feel so sensitive on my hair. Even the tags of the clothes can bother me. So after this, if you guys can watch some movies on autism, though in India, I think in Burfi, they have shown Priyanka Chopra and she had autism. So you can see the difference. Yeah. Burfi doesn't have autism. He has a speech delay. He is the deaf and dumb guy. But did you see his communication, his eye contact? But Priyanka had major issues with that. And along with that, did you see that in one part of movie, because I was seeing as a professional the whole movie, her foot goes in the mud and she's too aversive to that. So that's the difference between speech delay and communication delay. Along with that, they can have sensory issues. So if you want to watch that again from that perspective, that would help. Yeah. And they may not like to walk on sand or grass. They may not like to be in the queue. They don't like many textures of their clothes. When there is a texture defensiveness or tactile hypersensitivity. If it is vestibular, now we know vestibular function is a movement. They are too anxious about moving their head in space. They move very cautiously. And you know, these are the bachas whose gross motor skills will be affected because they are not moving much. They're extremely fearful of climbing or falling. They doesn't like their feet to be off. They may have poor balance because their vestibular system is hypersensitive. So if a child is not jumping, not going on the slide, simply you are just not going to put it there. There is a whole protocol of sensory integration therapy which is going to help these children. Auditory hypersensitivity. Now, when a hypersensitive, they are not okay with high pitched, loud, or metallic noises like the toilet flush, pressure cooker sound, burst of the balloon. They would be too aversive. And it affects their social interaction in crowded places, birthday parties. So sometimes when a child is not comfortable in social gathering, yes, it's a part of social communication issues of ASD, but along with that, it's their auditory hypersensitivity as well. So, are you understanding now how the definition of autism and their core symptoms we are relating with the science, how the sensory integration is affecting these parts, and how we can help through therapies? Olfactory and gustatory, again, I may be hypersensitive to taste and smell. So, if I'm hypersensitive, there may be a lot of food rejection, they may gag or vomit. They have a very hypersensitive gag. They have limited textures which they can accept to eat. So, those are the issues you can see. So all these issues has impact on learning, not directly but indirectly. They may have coordination issues, academics can be affected, they may have poor play skills. So it depends in a different ways depending on which sensory system is involved. And as we saw, there are 8 systems. There may be under responsiveness, hyper responsiveness. It becomes 16 ways, and every child may have different. Maybe I am hypersensitive to vestibular, but hyposensitive to tactile or undersensitive. So it can have a many combinations. So that's why sensory word is very big because there are so many different ways child can present. So that's why you have to see the set of things in a child. Just seeing one sign or one symptom, you're not going to diagnose. You're going to relate in many ways to that. And when we do the testing in the clinics and also there are the very, very good protocols where we are going to check sensory processing, language and communication, and then we are helping the child according to child's profile because every child may have a very different profile. So there are few screening tools for autism and chat, Indian scale for assessment of autism. Okay, so what is the autism intervention? So first of all, there is no cure for autism. So, but the very first important thing is you are early going to identify these children who may have these challenges. But if you talk about cure, okay, something which can cure it because it's not a disease, it's a neurodevelopment disorder. That's the way his brain is going to learn. But yes, functionality can be very high. There are many different classifications of autism. Asperger's is one which is very high functioning in a way, and many scientists or people who have been known to have Asperger or autism, like for Einstein, if you know, it's meant that he used to have autism. So that's why it's a different processing system. You're learning in a different way. But yes, there are some limitations. And through therapies, you're going to work on those limitations so that child or an individual can have a good opportunities to work. So there are different approaches. As we know in autism, there were different things, right? They benefit with the speech and language therapy, okay, which will help them to communicate verbally or non-verbally, both ways. Occupational therapy to improve their independence, their dressing, eating, bathing, all the skills can be improved with that. Sensory integration therapy, which we practice a lot in clinics, which helps them to improve their responses to sensory input, which may be restrictive or overwhelming. We talked about all sensory. So, in sensory integration therapy, it's a very detailed course. There was 4 modules to that. One module has almost 5 days of course. I have completed the whole four modules, and it is very detailed of every sensory system, their processing issues, and then therapy for that. And it has amazing effects. Not only for children with autism, children with cerebral palsy can also have sensory processing issues. Sometimes they don't like to be touched. And when you're doing NDT with them or physiotherapy with them, child doesn't allow you to touch. They are too scared to stand or walk, even when they have muscle strength. So, only developing muscle strength is not going to help this child who has a vestibular hypersensitivity. So I use these principles of SI with many children with CP when they were vestibular hypersensitive. So we use lot of dynamic surfaces, swings with them, bolsters and balls, which is helping the vestibular system to develop in a good way, because that is the system for our balance and writing reactions. And if I don't have that, how I'm going to walk? So that's what the sensory integration therapy is, not for autism, not for only Down syndrome, whoever has sensory processing issues. Physical therapy, yes, as I mentioned, many times children will have very low tone in their trunk muscles. Their shoulder girdle strength is so low. So it affects their writing because posture is so not okay. So you are working on that muscle strength by using a lot of functional activities with the child, not only strengthening by tying weight cups, no, functional one, because they have a functional low tone. That's very different. When I started my career, it was very difficult for me to identify, okay, functional low tone, because child is sitting, walking, running, and child with hypotonia is not able to achieve those milestones due to low tone. How do I differentiate? It takes some time to find those functional low tones. These children are leaners, their posture is not good, their movements are not so precise, their core muscles are weak. So that's why we call it functional low tone, and by using functional activities, you are going to help. Other comes the behavior approach. As we said, there are some repetitive behaviors, so there are few people who work on that. There is a ABA, one is the technique which say they okay, encourage the desired behavior and discourage the undesired behavior. If a child is hitting, you're how you're going to use the techniques. But from sensory perspective, I'm seeing, oh, child is hitting, he's seeking pressure. I am going to work on the development approach. So ABA is practiced by psychologists. There are some educational approaches because we know due to these they have attention span issues, and many times their learning is affected even they are so good visual learners and strong in that. So there are different educational approach. One is teach, which again followed by many special educators and in schools, so that we can help the child to adjust in the classroom structure and improve academic skills. Social relational approach. So we know, okay, communication, speech counts, but how do we develop those social connections? For that, again, there are different techniques. One is DIR, flow time. I did the first level of certification in flow time, and this tells that how the therapist can follow the interest of the child to expand the opportunities for communication. So, if you have seen our videos when we work with the child, you feel, oh, we are just playing with the child, though it has lot of planning behind that. So it's very difficult to find child interest, find the goal there, expand those opportunities because they have major issues with social development. So it's a lot of play based therapy, but this play is not random play. This has whole planning about it, how you're going to use that. RDI, then there are social stories, social skills group. We run many groups for people with AST to practice their social skills. How can they perform in social environments? Medications, yes, there is no medication to treat autism, but as we said, there are comorbid conditions can be there, which can be depression, anxiety, or impulsivity. So medications can be helpful for that, but definitely it has to be prescribed by a psychiatrist, and irritability or other things can be helped. So we are not the people who are going to do that. But if you feel child is really struggling, even with therapies, he's improving, but he's struggling with these, you can refer them to a psychiatrist who has a good knowledge of autism. Treating co-occurring conditions, these children may have insomnia, anxiety, depression. Many of them have ADHD. What is ADHD? It is attention deficit hyperactivity disorder. So that also a lot of psychotherapy and medications can help them. Yeah. So the very, very important thing about autism, and the reason when I got this opportunity to share with all the PT students, the very important thing was first to be aware about it. If I am not even knowing what autism is, oh, it's a mental disorder, or uh, they don't speak. So there are many myths about autism because we are not aware about it. It is a very, very detailed topic. But today's, when we are talking this, our only one reason was to share that first to understand, yes, there is one condition, neurobiological cases are increasing so much. That's autism. We have to be aware about it. What could be the early signs which as a professional you can identify, which as a parent, as a friend, you can identify these, so that child can go for the professional help, because early intervention plays very important role. If you are able to identify these issues at young age, you are going to use development approaches. You remember I talked about development approaches, different therapies as per child profile, and you are going to see those changes. Because brain is so plastic, you are developing those neuronal channels. It's not you're taking out autism from the child, but you are helping the child to learn these skills. Many activities which helps the child to develop their eye contact, their speech, their communication, their motor skills, sensory integration, so that child can perform near normal or high potential, whatever child has. Every child is different. So that's very important to early identify these signs. Now we have identified, but we feel, oh, it's a behavior when child is hitting, child is running around. No, understanding what are the sensory processing difficulties which could contribute to these issues. That's the way you're going to help the child along, because speech delay, you're able to see your child is not speaking, child is not looking at you. But here, what you are going to see, you're going to see there is an underlying cause of those behaviors. So, and for parents or for our society, it's very important they accept it, because it's a very taboo or stigma on people. There have to be acceptance, because there is no medical test to that. So parents feel very overwhelmed if they know their child has autism. So it's very important, how do you break the news to a parent? How do you help them? Not only as a parent, as a society, how do we have acceptance, support them, and include them? Already they are struggling with social interaction. So if you are not including them, they're going to have more issues, right? So that's very, very important. Yeah. So I would just uh, finish the session here. And if there is something which you guys want to know, I would love to answer. Thank you. Oh, I'm so much on time. Yeah. So I'm open to take queries, I'm open to take discussion. So anything Dr. Richa or somebody want to talk about, I'm happy to do that. Am I audible? I can't see anybody, or I can't hear anyone. I know you all can. Oh, I think you are on mute. Yeah.
Thank you, ma'am. It was such, it was such an interactive session, interesting session actually.
Yeah, I know, like, generally, I always love to see people and talk, but I know this is a beautiful way that, even when we are into the different geographical areas, we can still connect. I think that is the beauty of these sessions, that we can reach wherever we are. Yeah.
Students, any question? You can write in the chat box.
Yes, please do. So, there in their course, like, is this the part of some questions, like how you guys decided to talk about autism? Because it's very nice, actually, and but very few PTs are working on to that. So, I really wanted to know what was the force behind that. It's great initiative, actually.
आई थिंक मैम एक्चुअली हम हमेशा से यही चाहते हैं कि जो भी हम बच्चों के लिए वेबिनार्स या स्पेशल लेक्चर्स कराएं वो ऐसे हों जो उनके लिए इंटरेक्टिव भी हों, प्लस उनका कुछ अलग हटके उनके लिए कुछ अच्छा उनको पता चले,
Right.
because in our setup we are not able to get any autistic child here, so they
Hmm.
can't get exposure for that.
Sure.
तो इसलिए we thought कि
I
ये
think it's very
अलग
good. अभी
टॉपिक है.
मुझे ये है कि या एटलीस्ट कहीं भी if they are able to identify or see these children, तो हमें ये पता है, या it's one of the condition, and because prevalence is increasing so much, like out of अभी data के according US data, तो out of 44 one child is having, and India data may be like out of 100 children one child is diagnosed with autism. So it is very important to help our children and support that. So I think I was very obliged that you chose such a good topic for your students to help them to know about this condition.
I think they don't have any queries, ma'am.
Sure, I think that's okay. Means you guys can just embrace that. जो मैंने बताया था कि the reason that we talked about this today is not that you're going to diagnose autism. It's not about you're going to treat them. You're not, but हमें ये समझना कि yes, these are the conditions. इसमें ये साइन सिम्टम्स होते हैं, और क्या सेंसरी प्रोसेसिंग इश्यूज हैं, बिकॉज इट्स अ वेरी डिटेल्ड टॉपिक जो SI है. So anytime, even in the future, you want to know more about sensory integration, would love to do that. So I think that would be good for students to understand कि अच्छा, along with motor development, sensory development issues also we can go about. Yeah, sure. Okay. So shall we finish for today's session then, or how you want to go about?
Ma'am, I'm just no doubts, ma'am. No doubts. Any
Okay,
no student have any doubts. Thank you so much, ma'am.
it's
Thank
my
you very
pleasure.
much for sparing special this much time for your busy schedule. I thank
Thank
my
you.
department, my MD Shri Arvind Gupta ji, Principal Dr. Shalja Pant ma'am, our HOD, जिनके बिना शायद ये पॉसिबल ही नहीं था मैम. I
Right.
also thank Sunil sir, Kirti ma'am, Diksha ma'am, and Ashish sir for their unconditional support. Every time they are helping us for arranging these lectures. I also thank my IT department, जिनके बिना तो ये कभी भी पॉसिबल नहीं हो सकता. They all
True.
work day and night for the webinars and all special lectures we are conducting. And lastly, I thank my students who are listening so patiently that they don't have any doubts actually. इतने अच्छे तरीके से मैम वो सुन रहे थे कि उनको कोई डाउट्स ही नहीं है अब.
But still, I feel if you have a doubt, just go through it. बस पहले तो अपने आप को open the channels of learning. That's important for me. I'm still learning. Every day is a learning when you're working with children with the ASD
Exactly,
or this.
ma'am. Ma'am,
So
Kirti
I think,
ma'am has one question,
yeah.
that which was your toughest case,
Oh,
as you are
okay.
working since last 9-10 years in this autism
हाँ,
center.
so see, I would say कि हर बच्चे के challenges अलग होते हैं, definitely. Many times they have these challenging behaviors, जो हमने कहा ना सेंसरी इश्यूज की वजह से, तो आई वाज वर्किंग विद वन बॉय हु वाज 13 to 14 years of age, non verbal, he can't speak but he has lot of gestures, but he sensory issues इतने ज्यादा थे कि hitting was major. So when they are hitting, it's not a behavior, you have to help them through sensory integration. So in that way, physically they would actually hit you sometimes. Matlab, that was a case where a child was physically hitting you and you have to help them through sensory perspective. And I won't say that was a challenge, parents were, it was a big challenge for parents because he had siblings also. But when we started doing sensory integration with him and we started doing regular therapies with him, we saw so good changes. So almost 3 years we are seeing the same child, and it's difficult to believe it's the same child. Why? Because he is able to regulate it. तो मैं ये तो नहीं बोलूंगी हर केस कहने को डिफिकल्ट है और हर केस कहने को इजी है, मेन है पेरेंट एजुकेशन, क्योंकि ये प्रोसेस में टाइम बहुत ज्यादा लगता है. So when you are doing on sensory integration or you, because you are not curing autism, no. So how you can train a parent, how you can train the school, how you can train the siblings, so it's like a whole team approach to help the child. तो हमारे जो बच्चे होते हैं, दे देयर लव इज अनकंडीशनल एक्चुअली. कई बार वो बोल नहीं पाते हैं, कम बोलते हैं या कम वो होते हैं, बट दे यूज जेस्चर्स, दे लुक एट यू, दे मे गिव यू अ हग. सो आई थिंक दैट्स द win win situation for me as a therapist, where I see them improving. Yeah. So initially, yes, they have issue with the connecting with us, trust with us, but once you are able to develop that trust, they are very easy to handle.
Okay, ma'am. Any other queries? Ma'am, I want another question from Dr. Ashish. How emotions affect sensory integration?
Okay, so I will tell you that sensory integration or all the sensory processing issues, they have a very strong connection with our limbic system, and we know that limbic system is related with our emotions. So इसीलिए many times when children, when they have sensory processing issues, especially children with autism, they have lot of emotional issues. You will see them, their emotions fluctuations are so much. So because anatomically in the brain, it has lot of connection with our limbic system. There are many research about the hippocampus area of the brain for children or people with autism. So yes, it's all the neuroanatomy, because that's why they have lot of emotional disturbances. So it's due to their limbic brain, which has connection with their sensory processing.
Okay, ma'am. That's all. No other
Thank you.
queries? So, ma'am, any book or anything from where we can get more information about sensory
Okay, so
integration?
I will be definitely sharing some, maybe I can share those books and links to you. There are wonderful books about Anita Bundy. which is a book on sensory processing issues. It's wonderful book. I will share the link maybe by email to you. And there are few books which tells about the sensory strategies which a parent can use or a professional can use. So Anita Bandi have been my Bible when I was doing my masters about sensory integration. Yeah,
Okay.
but I would definitely share that on your panel or maybe by email so that you guys can actually keep that
Okay.
and students can learn more about sensory processing issues.
Ma'am, one another question.
Mhm.
Patient who has sensory over responsiveness, how can we treat them?
Okay, so as I mentioned, see, sensory over responsiveness can happen in all the eight systems, right? First, I need to understand, is he tactile oversensitive? Then I have to work in a different way. Is he vestibular hypersensitive? I have to work in a different way. So I will give very simple example. People who are tactile oversensitive, sometimes they are too aversive to accept the touch, okay, and that affects their day to day activities, their grooming, their interaction with the people. How do I manage clothes? I work with few children who could not accept winter clothes in winters because the texture, woolen texture or high necks, I cannot accept. Or whenever the weather would change, they won't be able accepting the textures. They may have basic issues with their grooming or feeding. So what we do, whenever there are tactile oversensitivity, you are using the other system, you are adding the proprioception into the picture. So when you're doing deep pressures, okay, you are helping the brain to modulate the texture system, same like a pain theory we work, no? So there are few oversensitive signal, along with that you are adding the proprioceptive inputs. So sometimes we do a lot of different brushes we use. There are different Wilbager protocol which we use for children or people who have tactile hypersensitivity, and the intensity and frequency has to be very much monitored. मतलब ऐसा नहीं है कि if a child is tactile sensitive, oh, he is not touching and you just make him touch all these things. No, he would become defensive to that. So first, I need to check which are the sensory system he's over responsive and tactile, what textures he's not affecting, which function it is affecting, and then I'm adding some more inputs to that. So we use Wilbacher protocol, you use pressure and proprioceptive system to help the tactile defensiveness or over responsiveness, you can say.
Um, Anyone else? One more question, ma'am. Where else sensory integration can be used except autism?
Oh, it can be you as I told you, it can be used in a lot of conditions where there are sensory processing issues. Children with cerebral palsy, many of them have sensory processing issues. It can be vestibular, it can be tactile, so you can use that. Children with Down syndrome, when they have low tone, many times they have proprioceptive dysfunction. So I use for them, I use sensory integration therapy for children with ADHD, and also the people who have lot of anxieties or where there are sensory concerns happening them, that also helps them. But yes, if you see in a major way, cerebral palsy, Down syndrome, you can help them. But yes, they have to have sensory processing issues. So when a child's motor development is affected, their sensory exploration is anyways less. If a child with cerebral palsy who is not crawling, he haven't touched many things because he had spasticity or dystonia. So if I haven't even accepted the touch, their touch integration doesn't happen. So that's why in early intervention, you're using all the sensations. I may use textured mats. I may help the child to open the hand, take weight on their hand, because it's very important they feel that. Same way, if a child has not developed sitting balance, you are working on the muscle strength. But child's vestibular system have not developed yet, because when children crawl in the 3D environment, they are getting the spatial awareness of the environment. So sometimes a child is 2 year old, have never rolled also. Rolling tak nahi hua. 3 months when they roll, their vestibular system is developing. Crawling, spatial awareness is developing. So children with cerebral palsy, not only NDT, I do the combination of sensory integration, giving them vestibular input, tactile inputs, developing their hand function. A dystonic child is not able to use his hands. So I'm using a lot of sensations also so that they are able to feel it. So it works as magic actually. When I started working with children with CP, using those swings, taking them on swing and helping their vestibular system to develop. So what would happen? It helps sensory motor development to happen in a whole way. So I would suggest use that with your children, and you would see much faster responses because their processing speed would change. I hope I'm able to answer that question.
Yes, ma'am. Ma'am, one more question. Can
Yeah.
sensory integration completely regulate emotions?
See, our emotions are not only the part of sensory. Because, see, if you have spoken very badly to me, or if somebody have treated me very badly, so I have that emotion in my brain. Yeah. So I won't say only the people who have sensory processing issues, only they have emotional issues. No, it has to do a lot with our emotional development, about our social development. So what happens? That's why in autism we know there is a part of social communication as well. Though, how do I cope that people who have anxieties or people who are in depression, not necessarily they have sensory processing issues. It is their emotional brain. So, if a person has sensory processing issues and you do sensory integration, it helps them into emotional regulation. Because sometimes when there is a very small thing happening and they are so frightened, a very small change they are not able to accept. So, sensory integration is helping them to develop their emotional regulation. But emotional disturbances can happen due to many reasons. So, that's why you are going to work on those social skills training as well, not only the sensory integration.
Okay. Any more? Okay, ma'am. I think this is all.
I think it was a lovely session, and
Yes, ma'am. It's very
thanks for having me.
interesting.
I really always enjoy discussing even the questions which came up. That was really nice, and those were very genuine questions. It's very important for us to understand why that's happening, how therapies are helping our children. So I think it was wonderful to answer those questions.
Okay. Thank you, ma'am.
Thank
Thank you
you
once
so
again.
much. Thank you so much. So I would be just closing this. It was great opportunity for me to share my thoughts. So thanks to you and the whole department of Dolphin Institute and Dr. Sunil. We shared the same college during our masters. So that's again gives me memories of my being alumni of Manipal. And Dehradun is again very close to my heart because I spent almost 6 years in Dehradun. I did my graduation there, and after my masters, I was working also for 2 years. So, wish you all very good luck to all the students. And it's a great initiative where you are helping your students to learn and understand all the perspectives. So,
Thank you
kudos
so
to you.
much,
Thank
ma'am.
you. Yeah,
Thank you.
thank
Okay,
you.
ma'am. Bye bye.
Okay.